3,000 cells per milliliter, which is low. Segmented neutrophils 2%, which is low. Band forms of 1%, which is low, and she has an absolute neutrophilic count of 90 neutrophils, which is low. She has creatinine clearance of 14 milliliters per minute. We're waiting on diagnostic tests, so pending is her central line, her peripheral line, and her urine blood culture. So today, her problem is febrile neutropenia with infection. Patient is currently in the induction phase of chemotherapy for treatment of acute lymphoblastic anemia, making her at risk for infections. RR also presents with low labs. Like I said, the serum creatinine, hemoglobin, hematocrit, MCV, mean corpuscular volume, white blood cells, segmented neutrophils, band forms, and absolute ANC of 90, which is all low. She also has redness around the injection port and a fever at 39.4 degrees Celsius. Fever is defined as 38 degrees Celsius or higher. And all this, which according to the 2021 NCCN guidelines, are indicative of signs of febrile neutropenia with possible infection. Due to the patient's ANC calculated based on her white blood cells, her segmented neutrophils, and her bands, due to it being 90, it is considered profoundly low and neutropenic. And so according to these guidelines, the patient is at high febrile neutropenia risk. And this is also due to her chemotherapy treatment and renal dysfunction, which further supports necessary empiric drug therapy with gram-positive and Pseudomonas coverage for a catheter-related SSTI infection. So the goals are to initiate antibiotics within 1 hour, as well as reduce fever and prevent further infection. For the fever, we're going to give her Tylenol, 15 milligrams per kilogram per dose, which comes out to 150 milligrams orally every 6 hours as needed. And then for the skin and soft tissue infection, empirically, we're going to give her vancomycin, 20 milligrams per kilogram per dose, which is 210 milligrams IV every 6 hours for 3 days. And then we're also going to give her cefepime for the Pseudomonas coverage of 50 milligrams per kilogram per dose, or 525 milligrams per dose, IV every 8 hours for 3 days. With these, we want to monitor kidney function for safety, so serum creatinine and creatinine clearance. Specifically with the vancomycin, we want to monitor for vancomycin infusion reaction. And then for efficacy and improvement, we want to look for decrease in fever within 48 hours. We're also looking for negative cultures at 48 hours, and as well as a recovered ANC. Specifically with the vancomycin, we also want to monitor for respiratory symptoms. What questions do you have for me?